Dr. Justin Sherfey, he's going to speak today about new innovations related to the shoulder. He's fellowship trained in adult reconstruction and joint replacement. One of the coolest things we like to brag about Dr. Sherfey is he's the first doctor of osteopathic medicine to be recognized in the Royal College of Surgeons and Physicians in Canada. And what's really cool about this is he's also the medical director of Palmdale Regional's Orthopedic Center. He's the associate director of orthopedics for the medical residents at Palmdale Regional Medical Center. So they have a family medicine residency program and an internal medicine resident program. The power that is within these two is a lot of times in the Antelope Valley, we struggle with very good primary care. As you have known, and we struggle with good internal medicine. Struggle getting appointments, struggle getting providers who will stay in the area. A lot of times a person will come here for a year or two, get burned out and leave. So in an effort to solve that, we've partnered with them and with Palmdale Regional, and they're building and training doctors who will stay in the area in the community. So that instead of saying your next appointment's in January, it's your next appointment can be on Friday. So on top of that, he's our physician liaison within the AV Alta Sports Medicine program, meaning that he's partnered with every time they injure themselves, kicking a goal or hurting themselves, he sees them. While he does all levels of orthopedics, we often call him the shoulder whisperer. And what that means to us is he whispers to your shoulder lovingly, "You're gonna do great." He's trained in lots of different therapies and modalities for the anatomic shoulder replacement and reverse shoulder. And he's a very skilled and talented surgeon to put your life into. And so I'm gonna pass the microphone over to him.
Wow, it is so fun to pay someone to come up and talk good about you for, 20 minutes. It is an honor to work with such skilled doctors and surgeons. I know that caring for you is one of the most important things that you can do in your life. I mean, how we take care of you, whether it's your health, your limbs, your activity, matters because that's your quality of life. And for you guys to trust in us to do that is really an honor. And it is something that all of the providers and all of our staff do take seriously, and we are very humbled and honored to do that for you. My talk is divided into two sections. First section is I'm going to touch on a little bit of AVORS in the community. I'm going to tell you kind of what we do and just touch on a few things that I think really make us special. And then I'm going to close it with the second half of doing information about shoulders. We sponsor a lot of things in the community, and we're involved with a lot of things in the community. So you'll see our name and brand around, and we're very proud of that. I mean, this is where we practice. This is the home for a lot of us, and this is where we want to be part of and help improve people's lives. We are very involved in community service here. One big thing that we do is just started last year is an AVORS toy drive and Christmas giveaway. So over 3,000 to 5,000 people came through that one Saturday to get free toys for their children. We had it in different age categories, and they came in, they got to meet Santa. Another activity we did is this is mainly the Family First group and providers, and they chose to take some resources and provide care packages to the homeless in our community. And so they literally got in our van and went out and drove around the community to different people they just found and different homeless individuals, and delivered caring words, caring attention, and then supplies that could help, get them through that day or that week. And again, it just shows some of the heart that we have in our staff and our providers, and how AVORS really wants to invest in this community. So another fun thing that we've done now for the last 2 years, and we hope to continue and make a tradition, is I've been leading a team on some mission work into the Baja California area of Mexico. We go to a small region called Vicente Guerrero and its surrounding communities. And there we build houses for some families in need. I mean, some of these people, you got to understand, I give them a ibuprofen and then they walk 10 miles the next day to come say thank you. They feel great. It's an honor and privilege that us as a business and us as providers can do things like this. I think it's important that you guys can see that, we're involved in this community and we're invested in this community, but we also try to take this anywhere we can, including around the world. But now I'm going to kind of talk on shoulder treatments. Shoulders are becoming a very in-demand treatment option. Traditionally, hips and knees are our biggest volume of replacements and issues. In the sports world, which I do a lot of, there's a ton of shoulder injuries, and so I take care of a lot of the rotator cuff and soft tissue problems, but there's a growing demand for actually replacement options. Over the last 10 years, I think I went from doing one every 4 months to now I do 5 a week. This demand for the options that we have technology-wise and what we can do is growing significantly. Quickly, just to touch on the shoulder. The rotator cuff itself is a group of 4 different muscles, and they help stabilize the shoulder and help it move initially. I always get asked this when people come in because they say, well, did I tear one tendon or 4 tendons, or where did I exactly hurt it? So even though anatomically it's made up of 4 different tendons, they kind of all fuse together. So when we say a rotator cuff tear, typically you've torn 1 or more of those, but when we get in there, it's kind of all one unit, okay, even though there's 4 different anatomic tendons. How you can injure it, you can injure it with trauma. A lot of times you can just injure it with age. A lot of people will come to me and say, my shoulder hurts. I will tell them, hey, I see a big rotator cuff tear on your MRI. And they'll say, well, doctor, I've never had an injury. I was doing great until 2 weeks ago and it started to hurt. But sometimes just age and wear and tear let this happen. Just over time, as we elevate our shoulder, the tendon will rub into the bone above it and it will start to damage it over time, and it can tear. And it can tear with or without you knowing it. And sometimes people are very surprised when I tell them they have a tear that looks years old and they're like, I never had a problem with this until recently. So it can happen. Symptoms tend to include pain, weakness. Usually people will tell me they have a big dull toothache kind of down the side of the arm. They can't lay on that side. And obviously certain movements hurt, particularly anything at or above the shoulder is where it really causes pain. I'm going to point out quickly, if you guys can notice, that I am raising and moving this arm. You can thank Dr. Entebbe for that. Dr. Entebbe operated on my shoulder, and so see, we even trust each other to operate on each other. So some non-surgical treatments. Initially, we'll try things to just help control your symptoms, number 1, but we'll also try to get the tendon, if it can, to heal or mend. I always get questions about injections, and 2 most common ones we use are cortisone, which is a strong steroid anti-inflammatory, or medicine called Toradol, which is just a strong non-steroid anti-inflammatory. And the biggest misconception of this is people come in and say, well, I don't want just a Band-Aid, I want it to get healed. And so I want you to know that these injections play 2 purposes. Number 1 is to help the inflammation and pain. That is the goal, that we put it in there. They decrease the inflammation and they help you feel better. But it's also not just to be a Band-Aid. It is to attempt to let the body do its job better. So hopefully by clearing out some of the inflammatory process in your shoulder, your body's healing mechanism can kind of wake up, look at it, and do its job better. So even though these can be treatments that may not fix everything, their goal is to provide a cure. They are always a great first-line option, and I encourage you to try it because it can lead to a cure, even though it doesn't directly mend the tendon. Then we start to get into some newer things you've probably all heard about over the past 5 years, 7 years. You've heard about different regenerative medicine treatments. These are things like stem cell treatments, or what we call platelet-rich plasma, or newer is even things called peptides. And these are basically things that we use from your own body, whether we take your blood or your bone marrow or your fatty tissue, and we're trying to kind of concentrate out your body's own healing cells to help the body do its job better. So a lot of these processes, we will harvest these and then we'll concentrate it and then we'll inject it back in. But now instead of having your normal amount, you have like 100 times that amount of these healing cells to really kind of stimulate your body to move forward. These are great. I'm a big fan of them. I've used them in myself in knee, elbow, shoulder, etc. But they're not magic, okay? And you have to have a realistic expectation of what they can and can't do. It's frustrating to me because I'm a big fan of these, that I'll hear other people will go somewhere and pay a lot of money for the treatment and then been told like some miracle is going to happen. So you just have to understand these are great options, but they're not magic, okay? They can only heal certain things. They can only do so much. And if you talk to any of our providers, we can kind of educate you on that. We can tell you if it's an option for you, and we can walk you through those things. The unfortunate part is that most of this is still not covered by insurance, and so it can be expensive and it's cash that you got to pay. But I think it's always nice to have an option if you're considering surgery or you're considering what you've got to do to heal yourself. You know, these may be things that you want to explore. Peptides are similar. These are synthetic building blocks that are made. For example, a lot of these new weight loss drugs that you're hearing about, you know, the Ozempics, the Wegovy's, all those are peptides. Insulin itself, which people have used for years, is a peptide. So peptides have been around 50 years or more. And now we're just starting to be able to isolate different peptides and synthetically make them. And then we're starting to use them as a treatment option. They have a little more whole body effect. We have some proprietary concentrations that are directed for muscle, cartilage, tendon, etc. And they can be effective. Again, not magic, but in the right use can be very helpful. Then we start talking about repair options. So if your rotator cuff is one that I think that we can fix or sew together or repair, this is just an animation that shows the basics of what a rotator cuff repair does. Basically, we make some small little poke holes and I look in with a camera. In the old days, we used to make a much bigger cut. We don't typically have to do that much anymore. Sometimes we do have to make a smaller incision, but most of the time it's done through small poke holes. This is just illustrating what a tear looks like. We go in there and we kind of clean it up. We get the bone to bleed a little bit, and then we put in these devices that anchor into the bone and have suture attached to them. And then we use different instruments to pass these through the tendon, as you can see there. And then once we get these all connected back to the tendon, we're gonna sew it together and move that rotator cuff back to its attachment to cover the area it's torn from. And this is just one way that we fix it. There's a handful of ways. Obviously, this is made by one manufacturer to show their product, but the concept is the same. So that's how we do a repair. And if you're a candidate, that's always the best option because I can put you back together. Now, it takes a while to heal from that, but it is a very good option. And we'll go into some of the recovery in a minute. Unfortunately, if I can't repair your tendon, there is still options, okay? Over the last few years, few different options, and I'm gonna speak on just one manufacturer's option, have come out with what I can do if I can't fix it completely. So sometimes I can go in there and I can clean it up, or I can partially repair it. But there is an option now that I'm using, I think I've done it now for the past 4 years, is made by a manufacturer called Stryker, and it's called the In-Space Balloon. And basically, it is a little balloon cushion that I actually put on top of the rotator cuff to protect it. If I can't fully fix it, it gives you an option. Now, this animation is going to show a little bit the same thing of how that balloon looks like and what it does when I get it in there. But the thing to remember is this isn't a complete repair. This is a solution to buy you some time. Because unfortunately, between repairing it and not repairing it, the end result is a shoulder replacement. Okay? And sometimes you're not ready for that surgery. You're not ready for metal and plastic. You don't want that big of a procedure. So we got to do something in between. This can last, data shows that it can give up to about 5 years relief. What you can see here is it's done through just small little incision. We kind of clean up the tendon and basically we inflate this little balloon. You can see going in, it's just what it is. It's filled with saline and it goes in there and acts as a cushion. So now when you move your arm, the bones don't rub together. They hit on this little balloon. Now that balloon dissolves away in about 6 months to a year. And so what it leaves is it leaves a little scar tissue kind of cushion layer there. And that's what can potentially last up to 5 years. But again, it's not a perfect result. It's kind of a thing we can do in between. It doesn't guarantee you can move it completely, doesn't take all the pain away, but it can make you much better than where you were, and it can buy you that time before we have to talk about what's next. Shoulder arthritis. This is where the actual bone and joints start to wear out, okay? The cartilage surfaces where they rub together start to cause pain and wear out, and that creates stiffness, grinding, limits your motion, and that's where we only have shoulder replacement options to fix that. Like hips and knees, this is what we do for that. There's two different types of replacements that are done. One is called like a standard total, or what we call an anatomic total shoulder replacement. It's great. It replaces the damaged joint. It restores motion, relieves pain, and it can last a long time. Results are greater than 10 years that still have a good functioning shoulder replacement. What these do is this is basically where we're just going to cut out the arthritis and we're going to replace it with a metal ball and a plastic socket. Like we do in a hip or a knee, it's the same basic procedure. We are just doing it in the shoulder. This still relies, though, on your own muscles and tendons to make this work. When we do a traditional replacement or what's called the anatomic replacement, it is good when you have a working rotator cuff tendon. If you do not, we have to look at other options, okay? And I'm gonna get to that in a minute. So this is when we use this. It is probably our best result for a replacement. However, in my experience, I used to do 90% of this and 10% of the alternative. Over the last 10 years, I now do 90% of the alternative, which I'll get to next, and 10% of this, because Most people, by the time they're ready for their replacement, have a significantly damaged rotator cuff. And when you have that, then this isn't going to be the option for you, and we have to talk about what's next. So we put this little plastic piece on the socket. We don't replace everything, we're mainly resurfacing it, and we put this stem inside your humerus, and the top part's a metal ball, and they rub together and give you a new joint with pain relief and hopefully improved motion. None of this gives you back a totally normal shoulder. The goal is to give you pain relief with activities of daily life, okay? And help you kind of get back to the things you want to do. The next option when you don't have a rotator cuff, like I said, the alternative is what's called a reverse total shoulder. And this is, well, like I said, I do 90% of this now because most people have a significantly damaged rotator cuff. This is the same basic surgery. However, we switch the position of the ball and socket. So instead of the ball being on the arm or the humerus side, it is now on the socket side. And the socket is now put on the arm side. And why do we do that? We do that when your rotator cuff isn't working and can't be repaired because it lets this big muscle here on the outside of our arm called the deltoid act as your new rotator cuff. And it can restore some of the motion and function as well as help your pain. So that's kind of basically what it looks like up there. It's the positions are reversed, and that kind of helps us compensate when you don't have a working rotator cuff. We also use this a lot when you have a fracture because all the muscle and tendon attachments have been broken. That's kind of what we do, and like I said, this is actually what I do the majority of just for what comes in the door and what everybody's shoulder look like. So there's a quick comparison of the types. When we do what's called an anatomic, it's when you can have a functioning rotator cuff and we're just treating isolated arthritis. We do the reverse when you need more options and you don't have a working rotator cuff. Here's kind of how I recommend you look at your shoulder pain and think about the treatments. Always I recommend try non-surgical options first. If I can repair something, do the repair because it's always going to get you the best result. It's going to get you as close to normal as I can. If you're a candidate and I can't repair it, we can talk about that in-space balloon. Not everybody is a candidate, but it can be a good bridge before we get to a shoulder replacement. And unfortunately, if your rotator cuff is unrepairable or you have significant arthritis, you look at a replacement. A couple quick things on what to expect in recovery. A repair is going to take a long time. Is 6 weeks that you're very limited. You're in a sling. You can slowly move and use a little bit, but you're very limited. After 6 weeks, we start to move you forward, but it's 4 months for that tendon to heal to the bone. And at 4 months, I say goodbye to you, but you're not happy. You'll be happy in a year. It takes a year to fully recover from that. If we do a replacement, usually we slow you down the first 6 weeks. And then we slowly get you going. You get moving a little faster. There's not as much limitations. And around 4 months, you're back to most thing. Again, full recovery is about a year. The in-space balloon is similar to a repair, but just not restricted as long. First 6 weeks, we let you move it, but limit it below your shoulder. Then we start to advance you with therapy, about a 3-month to 6-month recovery. And the reverse, we start motion a little sooner, but it's still about 6 weeks over the surgery, 3 to 4 month recovery, and full results at a year. Couple questions to ask us when you come in. You want to look at, hey, what are my options? What's the risks, benefits? Always want to review how long it will take, what your restrictions will be. Should I look at any different imaging or therapies or anything else I need first? And again, the big question is, what's going to be my outcome? How's this going to affect my life and hobbies? Remember, it's your shoulder, it's your choice, and we're just here to provide you options and give you care. All right, I know that was a lot to get through. Thank you very much. But it gives you a little taste of the shoulder stuff. Thank you guys.